and gentlemen. Next, help me welcome to the stage the Deputy Commissioner for the New York City Department of Health, who also led the first public health department in the United States to sign on to U equals U consensus, Dr. Demetre Daskalakis.
Hello. Good afternoon. So I get the doctor job and I have some slides. I'd like to think that rather than an elder, I'm more of a bad bitch, but I'll take elder if I need it. So my job is to give you a little tour of U equals U from the science perspective and really talk a bit about what it was like to be the first public health official at the first public health department in the world to declare very boldly and loudly that U, in fact, is equal to U. So when I used to do this talk years ago and had to show the data about U equals U, I was arguing. I was presenting to make an argument. And now, this is how I do it. Here are all the recent and pivotal clinical studies that prove that undetectable is, in fact, untransmittable. HPTN 052, 0 transmissions if virally suppressed. Partners PrEP demonstration project, 0 transmissions if suppressed or people were on PrEP. Partner study, that row of dots all on, 0. No transmissions. Opposites attract, 0. And my favorite, Partners 2, you'd have to try to have uncondomless sex for 419 years, sounds fun, right, to have an HIV transmission. So really, where is the question? Where is the debate? And I think, as you heard from Bruce, the debate is over. U, in fact, is equal to U. Data has proven it. No more debate. But there are still naysayers. There are people that say that if someone has a detectable virus in their genital fluid, they could theoretically transmit HIV. If people have blips, they could theoretically transmit HIV. And my favorite other one is that someone with an undetectable viral load with an STI could theoretically transmit HIV. They just don't. So it's over. Data over dogma. We already have the proof. This is not about a provider's comfort level. It's about science and data, destroying stigma and the zero divide that has damaged so many lives and relationships in this epidemic. Suppressed viruses don't transmit. End of the story. Period. And in fact, not sharing this information with your clients, patients, friends, lovers is withholding data that is life-saving, life-prolonging, and stigma-busting. Now, and get ready for this. You have to listen to what I'm going to say now. If at this point in this struggle, you are not with us, you're against us. It is irresponsible public health to not spread the word, the gospel, that undetectable is equal to untransmittable. So if you're not with us, get with us. Now, the other part of this is that this message was beautiful. It's really important, but there's a story of how it happened. It built up. But it really starts a while back, even before there was U equals U. And I think we heard about the Swiss statement. When this came out in 2008, so many people were uncomfortable because it just didn't feel like they had data, but they did. And the statement was clear. An HIV-positive individual just doesn't transmit HIV if they're virally suppressed. But people weren't willing to accept it. Flash forward, July 2016, to one of the earlier consensus statements from the Prevention Access Campaign that said undetectable is equal to untransmittable. That's a lot of years between the Swiss statement and this. But then a couple of rapturous things happened. First, the NIH says things like 100% of virally suppressed people will not transmit the virus to their partners. The chance of HIV infection from a virally suppressed individual is? 0. Yeah, let's debate it. So the NIH said, no, you cannot transmit HIV. So then it became really easy for the Department of Health in New York City to say, well, the data shows it, so there you go. U is equal to U, New York City signs on. The CDC then follows and really signs on to U equals U by effectively saying there's no risk transmission. New York State signed on, and then a torrent of other people signed on. And I think Bruce has talked to you about that a lot. Literally changing the world and removing stigma in the most aggressive move that HIV has ever seen in the history of the epidemic. So, let's talk a little bit about what we did. So you can say whatever you want. U is equal to U, you can sign on, but you gotta walk the walk and talk the talk. Everything that you do in public health that revolves around HIV has to change to mirror this. One fantastic example, if you've not seen it yet, is the recently released New York State guidance written by a lot of New York City Department of Health folks that give providers ideas of how to better implement U equals U in their practice settings. Go visit that at hivguidelines.org. It's worth a read. We also, in New York City, put up FAQs for providers and for people living with HIV or interested in this area to learn more about U equals U. So you can't just sign on, you gotta shift things and prove that you really believe that the data is true. You can't have things that say there's a risk of transmitting HIV if people are virally suppressed when you shift your entire dogma, your entire sort of thought process into the U equals U space. And we also have done a lot of work in New York to support the notion of viral suppression and undetectability. One that we're really proud of is scaling up a really important project by Housing Works. This was a part of our Ending the Epidemic strategy. It's a multi-domain campaign, this Undetectables campaign, that really looked at ways that we could support people living with HIV to live healthier lives, to become virally suppressed, and have that great side effect of treatment, which is that they don't transmit HIV. We've done it through very aggressive means, including providing people financial incentives to stay virally suppressed. That means some dollars in your pocket if you maintain viral suppression. And guess what? It works. More to come. So, beyond that, we also think that it's important to start people on medicines on the day of their diagnosis. I remember when I was a fellow in 2006, in infectious diseases, the idea of starting everyone on HIV meds seemed weird. And whenever we tried to do it, there was always pushback. The data don't show it, don't do it, don't do it. Well, that's over now. It's pretty clear. If you're newly diagnosed with HIV, if you're willing to do it, you should start on the same day whenever possible. Why wait? We don't wait for other things. I don't say, oh, I'm sorry, you have tuberculosis. Let's think about it for a little bit. No, that's weird. So really the idea is if you got something, treat it. So we've been working really hard to launch a lot of programs, and in our sexual health clinics, if you're diagnosed with HIV, on the day of your diagnosis, we start you on meds if you want to. Really important. And by the way, thank you. By the way, what happens is almost 94% of those people are retained in care 6 months after their start. And so there's another really important lesson that I've learned from U equals U, which is that HIV treatment is really a guiding principle for everything that we do in terms of ending the epidemic, whether it's for people living with HIV or individuals at risk for HIV who may be PrEP candidates. We've done a lot of work in New York City to make it clear that prevention means somehow interacting with healthcare. So you can see some of our campaigns behind us in Spanish and English, like really focusing on cis and trans women, really making it clear that if you want to go on PrEP, that's a really good strategy. And what happens in New York City is that we're seeing great success. So this is a little data slide just to show you that about 40% of our men who have sex with men in New York City are in fact on PrEP. And if you look, it actually stays across race. So it's a lot of other places experience high PrEP rates in white MSM, but lower PrEP rates in others. That's not what we see in New York because of the effort to launch it where people actually seek their care. But it's not all about PrEP. In fact, the PrEP model is completely hanging upon our strategy for HIV treatment. One of our top priorities is treating people living with HIV because what happens is that they stay healthy and they have an amazing side effect of their drugs. They don't transmit HIV. The primary goal is treatment. The secondary outcome we care about is prevention. And as Tony Fauci said, U equals U is truly the foundation of any strategy to end the epidemic of HIV. You get 2 for 1. And in New York, we still have some work to do, but we're getting there. About 74% of all the people living with HIV in New York City are virally suppressed. So we're really moving in the right direction and moving there very quickly. Yeah. So at the end of the day, what U equals U has taught me from the perspective of creating a prevention strategy is all you have to do is do what's right for the individual. You do what's right for the person. And if you do what's right for the person, you're going to figure out a way to end HIV and end an epidemic. We have this idea of a status neutral strategy, and what that means is that HIV test is a gateway. If you're positive, you enter the gateway of service and care in New York City, and that gateway means that if you are following guidelines, you are starting HIV medicines, maybe even on the first day of your diagnosis, we give you quality care, and if you support that quality care, we have this end goal of having you engaged in treatment. And if you're engaged in treatment, guess what happens? You become virally suppressed, and U equals U, you don't transmit. Same for the PrEP side. HIV negative folks, if they're at risk, they enter the system, that test opens the gateway, and it's the same model we use for HIV care. We look at them and say, if we engage you with high quality preventative services, you engage in prevention, and if you need PrEP, you go on it, and then you can't get HIV. So those two things in combination are a winning strategy, but ultimately it requires government and other agencies to think creatively and not always work in silos, because those silos work against us over and over and over again. Thank you very much.
Woo! Thank you, Dr. D. Ladies and gentlemen, now help me welcome